Welcome to the Pharmacists Are In, a podcast made for pharmacists by pharmacists. Pull up a seat and let's get started.
Welcome everyone back to the Pharmacists Are In podcast. My name is Ajit Johal. I'm a pharmacist from Vancouver, British Columbia, and I'm joined by John Papastergiou, pharmacist from Ontario. The province is so big that I don't even know what city he's from, John. So we are back with
Toronto, downtown Toronto. How you been? I haven't talked to you in a while. You good?
I'm good. Just surviving with work and family. It's definitely been busy, and we're in the thick of flu season, John. Flu season.
Toughest time of year. I know it started. It seemed like it snuck up on us this year, and it's kind of gone full throttle now. In Ontario here, we just opened up to the general population. We've got a little window where seniors and high risk patients go first, and then it opens up. But this last week's been quite a rush. But before we get to that, I wanted to congratulate you on your big award. I saw you won the CFP Innovation and Immunization Award. That's pretty cool.
Oh, thanks, John. I appreciate it. It's definitely been a very exciting journey with the work we've done at immunize.io, and just very, very proud of what we've accomplished, and want to continue doing great work to protect people, locally, nationally, and globally against vaccine preventable diseases like influenza.
And I think some of our listeners may not know that much about immunize.io, but really, you guys really, thought out of the box when you started that organization, because there wasn't really anything like that, especially in the pharmacy space. There's a ton of groups that advocate, for immunization, vaccination, and whatnot, different therapeutic areas. But yourself and your colleague Mark, really, I thought, I think that's how we first met, but you get really were thinking out of the box, and it's been amazing to kind of stand by and watch that group grow and all the incredible things that you guys are doing. So if anyone listening wants to check out the website, it really sets kind of, I think, the stage for what's possible even out of the pharmacy space when you really want to focus your business on immunization and the value that it provides the patients, right?
Oh, definitely. And I think, it all starts with with influenza. And I remember when I graduated from the University of Toronto and then went back to, my dad's pharmacies in BC, the first thing I did was set up their influenza program, because it had been a couple years where pharmacists could do the influenza vaccines, and the adjacent doctor's clinic, the nurses were like, yeah, if you can take this from us, it'd be much appreciated. And I think we did about 500 flu shots that season. And after that, I was just so inspired and passionate about immunization that we started doing all the other vaccines. But it really does start with flu, John. Like jurisdictions, like you've been to talks in Europe and other jurisdictions globally, like it all starts with flu. Even Singapore just has a pilot with 3 pharmacies doing influenza vaccines. So this is a really key vaccine to enter pharmacists into that expanded scope.
Oh yeah, I was just at FIP. I think I mentioned that on a previous podcast, and that's what I started. Other jurisdictions are always interested in, okay, how did Canada, grow their scope, and how do you continue down this path around expanded scope? And it's that exact point I said. It starts with flu. If you could showcase the value you could provide to flu, everything else will come, and then the public will start asking for more. And any country that has a successful kind of pharmacist directed vaccination program will say the same thing. And I think that happened here. I remember it was part of back then it was called the Ontario Pharmacists Evidence Network, and we really spent a lot of time looking at metrics and trying to gather data about the pharmacist's impact on flu specifically. And then we used those numbers to help get scope in other areas and whatnot, and grow the immunization programs. And it's amazing to see where we've come. But yeah, it's every October, doesn't matter where you are in Canada. If you're managing a pharmacy, running a pharmacy, if you're a staff pharmacist, you start thinking, okay, how am I going to prepare for this? I mean, we're one of the, I think, biggest vaccinators in the country here at Shoppers at Coxwell and Danforth. I mean, and we're seeing 300-400 patients a day right now. It's really
Wow.
ramped up, and it's we didn't start like that. And we built that business around flu, and now the
Hmm.
community knows, hey, if I want to get vaccinated, I could go to that store, I can make an appointment, whatnot, but I can walk in and we don't turn anyone away. But if you want to offer a program like that, you have to prepare for it. You can't have one pharmacist, one tech working and think you're going to be able to manage that. It really is about workflow management and everything else. And I said to you that it's here in Ontario. I'm not sure if BC is the same. We open up first to the seniors and the high risk patients, and that's something I wanted to talk to you about because I think
Hmm.
this is a real important point. Every year we get a run in Ontario on high dose flu vaccine, and it goes very, very quickly. And then
Hmm.
pharmacists are faced with this question: what do I do? Should I wait, for HD to come again? And we don't always know when we're getting it. Distribution's always been a little bit of a mishmash here. It seems like it's
Hmm.
running pretty smoothly, but or what do I do? And that's, being the expert, I wanted to get your opinion on this because I get asked, from pharmacists all the time, what do I do? Do I send them away? And I think there's a clear answer to this, but I wanted to hear your opinion.
Oh, definitely, John. Well, I know you know the answer to this. In short, you should never turn someone away when you have an opportunity to vaccinate them. And obviously, there are options for seniors. And as we know, for older adults, after the age of 65 with age-related immune system decline, you're at higher risk for influenza-related disease and complications. And that has to do with age-related immune system decline, but also because of the natural accumulation of not one, but probably multiple medical conditions. So unfortunately, older adults in this country suffer disproportionately from influenza, and we have options to protect them against disease. And because of the aging immune system, as you mentioned, you could use a high dose, which has more antigen, or you can use an adjuvanted vaccine, which also takes the same 15 micrograms of dose, but mobilizes more of the immune system. And I think what the challenge comes in and is that if someone's in front of you, obviously you want to give them a enhanced option, which is either the high dose or the adjuvanted vaccine, or even give them the standard dose, John, because if they leave, they might get the flu and they have nothing. So it's better if they're there to get vaccinated. And when it comes to sort of the enhanced options, whether high dose or adjuvanted, there was a good NACI review, so the National Advisory Committee on Immunization, has said that, older adults suffer disproportionately from influenza, and they should have an enhanced vaccine, either the high dose or the adjuvanted. So there are two options. I know in BC, where I'm from, where I practice, we are using the adjuvanted vaccine. So it's the adjuvanted trivalent vaccine that is used for those over 65. And we also run into the same issue with supply. I think that, if you're going to have a priority program, you should have more supply. We can't control that. But what pharmacists can do is let patients know that there are multiple options now to protect them against influenza. And not just now, it's been like that for a while. And they are, both regarded as preferential versus the standard dose.
I think that's super important. And I think if you could even expand on that a little bit, I think that's what, the frontline community pharmacists have to realize. I think the marketing around HD vaccine has been so good over the last few years that
Mhm.
even pharmacists aren't always aware, is there a difference, is there not? But when you look at the literature or the evidence or the guidance, what does it say?
Well, it's really interesting because it's very difficult to really. So there's no head-to-head between the two.
Yeah.
But there is a head-to-head randomized controlled trial between high dose and standard dose. And there's also real-world evidence showing the adjuvant versus the standard dose. And when we look at the actual science, we look at somebody who's 70 years old, they have COPD, they have diabetes, versus someone who's 30 years old and has no medical conditions. It's pretty obvious that they probably shouldn't be getting the same flu vaccine because the response they use with their immune system is probably not going to be the same if we give them the same thing. Going back to what I was saying earlier, obviously, if all you have is a standard dose, it's better than nothing. But there's a couple of things we can do with science and technology and increase the antigen to give their immune system more to work with so they mount a better immune response. That's high dose. Or they could use the adjuvanted vaccine. And the word adjuvant comes from the Latin word adjure, which means to help. And that basically takes your immune system and mobilizes it to provide a more robust immune response. And what the evidence shows is that individuals who are over 65, if they get either of those options, they do better. They have less influenza-related attack rates, they have less hospitalization, they have less death. They looked at other endpoints as well. So the flu can also cause things like respiratory disease, cardiovascular disease, worsening those in those with underlying conditions, triggering different sort of inflammatory responses. The confidence intervals were a little wide, but it again showed that obviously if you prevent the flu, you prevent these complications. So when we look at flu vaccines, each season is obviously different. There's different matches. And so why it's important you should get your flu shot every season. But what's really, really cool is looking at the real world evidence, looking at sort of databases on who got which vaccine and who's getting hospitalized. And it shows that older adults do need should get an option that's different than the standard dose if it's available. And if it's available, either the high dose or the adjuvanted vaccine are appropriate options.
You've heard it here first, people, and I think this is important because I started today's podcast talking about the operations of managing a very busy flu program, and this is something that I think historically it's not happening everywhere. I think we're turning people away unnecessarily for out of HD vaccine. We don't have to do that,
Yep.
We've got a great alternative. You just, highlighted or summarize the evidence there. Vaccinate these patients when they're in. I think it's key. And that's one of the reasons I don't, turn people away if they walk in. We've got them there. You've got a captive audience. They're interested in getting vaccinated. If they leave, you may not get that chance again. And that becomes
Okay.
super important. And it ties into the next point I wanted to make around co-administration. Because we have a
Mm-hmm.
very, very high co-administration rate. And I think pharmacies in general are doing really well when you look at the data. But ask the patient about COVID vaccine. We've got a new vaccine. They're in here. They're looking for flu. I'm telling you, yeah, if you ask them, a big chunk of these patients will say, yeah, just give me both. I don't know if you've seen that in practice.
Yeah, no, definitely. I think some patients are a bit more proactive about it and say, can I get both? But if you actually ask them, hey, did you want to get your COVID shot at the same time? They're more than happy for the convenience to have them both. And if you listen to a previous episode in our podcast when we talked about COVID vaccination, there isn't this sort of increased synergy of reactogenicity as they might have two sore arms, but it saves them a trip and they're protected sooner. So definitely get your seasonal flu shot. It's important to get your flu shot every year because of the potential antigenic drift of the virus. There's some mutations that happen, especially with the H3N2 strain. And also there's this waning immunity that happens with both influenza and COVID vaccination. So it's important to stay up to date, especially if you're a high risk individual like our elderly population.
And if I'm thinking of operational tips or pearls here, have your technicians ask. I know a lot of us are focusing, there's administrative work, you're doing the consent, they're coming in, they're asking for flu. If you have the technician, ask them about COVID right at the top, they'll
Mm-hmm.
process that work. Here we've got an additional step with Covaxone and everything else. And you get that administrative burden out of the way. And then when the pharmacist sees them, they give both vaccines. Because I find if you're in there for flu, you give flu, and then I ask them, "Hey, do you want COVID?" They say, "Absolutely, let's do both now." Now I'm giving both, then I'm sending them back to do the administrative part, and it just messes up your workflow. So real simple step that you can kind of implement, and it'll help smooth things out during this busy period that's kind of going to last the next month or so. The other thing I wanted to ask you, okay, this is from the pharmacist perspective. Okay, we understand now. There's benefit to either adjuvanted or high dose flu. But what do you say to the patient that comes in and say, I saw a commercial for high dose. My physician mentioned high dose.
Hmm. Hmm.
I think I want the high dose vaccine. I haven't heard of this other one. I don't even know what you're talking about. What do you say then?
Yeah, no, that's a legitimate question because a lot of times patients have this sort of brand preference that's very powerful, and it's often difficult to convince them otherwise. But I would ultimately say is, it's important you get your flu shot. And obviously you're aware of the risks, your physician's aware of the risks of influenza. So it's important that you get vaccinated. The other thing I would say is the high dose is preferred for your age demographic because of its ability to provide a superior immune response compared to the standard dose. And I would also say there's another option that can do the same thing that can also provide you a very good immune response. And to be honest, my suggestion to you would be as protected as soon as possible because you're going to be around people, you're going to be around family. We are starting to see flu cases trickle in. So take this opportunity to protect yourself against an option that the National Advisory Committee on Immunization has also deemed to be a great option for older adults. And I strongly recommend it for you. And I can actually give that vaccine for you today. And that's the key thing. All that I said there, John, that last bit is the most important is I can give this to you today. And someone really has to think is, am I going to wait tomorrow for something that I might think is better, when in reality my pharmacist is offering me the convenience, and that often is a very powerful motivator, John.
Oh yeah, and that yeah, I think you hit on a key word there when you say make that strong recommendation. I think we sometimes forget the impact that we have and our recommendations have on these patients. I've said this before on the podcast, we own the relationship. We see these patients more than anyone else, and they're used to coming to us for vaccines now, so they trust you. And if you make that strong recommendation, I find 9 times out of the 10 they're gonna go along with what you recommend. So I think that's super important. It's just I think in practice we've got all these things coming at us in the community pharmacy, and we're trying to
Totally.
now balance the weight of all these patients that it can be sometimes very difficult to kind of do all of this and do it efficiently. And that's why I think the planning going into flu season is so important. The scheduling, making sure you have enough technicians, have that overlapping pharmacists, and there's no cookie cutter approach. I mean, every pharmacy is different, your demographics, the volumes you do, but it's really if you're able to plan, you'll be surprised how fast this business will grow and how now it's going to permeate out into other vaccines because we have the ability to do all these other things. You become like a destination for it.
Hmm.
You can really grow a big business around it.
No, I definitely agree. And even when I talked about, the story behind immunize.io, it's having a very strong pharmacy-based influenza program sets you up to do a lot of great things in with expanded scope, which is really important.
And I think this, I mean, we're going to leverage some of the work being done here. I think we're going to see, I mean, we're on the cusp of more scope here in Ontario, and I think it's all again built on the success of our immunization programs. I think we're going to see more minor ailments, hopefully chronic disease prescribing sometime in the near future. But we're seeing some success with our point of care programs too, and flu is part of that. Given all that, Ajit, and kind of the potential new scope, but one thing I have noticed, and I'm not sure if you're seeing the same trend in BC, but I've seen that, when I think about the seniors, they're coming in, they're engaged. I think they understand the importance of getting vaccinated. Where it's dropped off dramatically and where I'm seeing not as many potential appointments, not as many walk-ins, is in kind of the middle-aged adult group, both male and female, where I think they've kind of gotten this idea that they've been over-vaccinated. And I think it's almost
Hmm.
become like pulling teeth. And I know we've talked about this in the past, but have you noticed the same thing this year?
Yeah, I think like this is being seen in a lot of jurisdictions, and obviously we talked about how our older adult patients or senior patients over 65 are at high risk, and vaccination rates in that cohort tend to be better. I think there's obviously, we should still continue to strive to be consistent and keep increasing that. But you're absolutely right, is middle-aged patients are starting to drop off, and it actually alludes to what you were saying earlier about chronic disease management. We recently there was a published paper in Vaccines MDPI where people who had chronic conditions or immunocompromised weren't aware of their own risk. And I think that's where people who have chronic medical conditions where do they get their medications from? The pharmacist, and educating them to say, hey, you know what, like with your blood pressure or your cholesterol, if you get the flu, it's going to be particularly worse if you have these conditions. And I think, we talked about in a previous episode how pharmacists have that role to talk to their patients on chronic conditions. And I think that's part of the management. Chronic disease management is being up to date on your vaccines. And one of those vaccines is the flu shot every single year. And it's interesting because you talk about vaccine fatigue, but vaccines are that intervention where you are quite easy, right? It's not a pill you have to take every day. I'd love for you to quit smoking, but you have to commit to that. I'd love for you to exercise 150 minutes a week. I try and do that, John. I don't know how things are going for you, but and also to eat according to Canada's food guide, right? And these are all chronic disease interventions that are really important, but easier said than done, right? Easier to say, hey, do that, versus how hard is it to roll up your sleeve once a year and get a vaccine against a disease that could potentially put you in dire straits. So I think patients are certainly fatigued from vaccines with potentially getting a couple COVID shots, but we have to remind them in terms of the broad scheme of staying healthy and longitudinal health, vaccines are as easy as it gets, John.
Yeah, no, you're absolutely right. And just to add to your comment there, I've been training. You might not recognize me next time you see me. I'm so ripped, but from
I look forward to
those
it.
potential risk factors. But you're right. Like and it's such an easy thing. Like we're filling these prescriptions for hypertensive medications, cholesterol medications. People are coming in for medication reviews, A1C tests, lipid screens, all these things that we do in pharmacies. It's such an easy thing to say, hey, have you considered getting vaccinated? You have these comorbidities, you have these risk factors. The guidance and the evidence is clear. Let's get you vaccinated and prevent these complications down the line. And I love bringing up Dr. Iris Gorfinkel's line because she yells it on the radio every week. Lung disease begets more lung disease, and
Mhm.
we're really should be thinking about not only flu, not only COVID, but RSV as well. And I actually had a pharmacist call me from a rural part of Ontario a few days ago and say, John, can I give all three together? And I'm like, oh my God, I thought we were past that. Absolutely, you can give all three together. And you tell the story of giving as many as, 7 or 8 vaccines at once. But yet these are things that I would hope are soon going to be no-brainers for pharmacists. You've got someone that wants all three vaccines, give all three at once. Let's get them vaccinated and
Mhm.
start thinking about other areas where we can make a difference.
Definitely. And I think, again, since we're in the thick of influenza season, recognizing that having options is always good, right? Having
Yeah,
options, we had an RSV podcast earlier, multiple options for the RSV vaccine,
yeah,
multiple options for flu vaccines for seniors, high dose and adjuvanted. Options are always a good thing, John, because if you run out of one, then you have the other one to fall back on, and we have to let our patients know that. I think that again, just to reiterate, the vaccines for seniors are both really good vaccines. And one thing that actually might come up, and it came up last season, is quadrivalent versus trivalent, John.
yeah. That
And
came up
that,
last season a lot of times. That was kind of going to be my last question for you. What do you do then? This scenario, right? And there's a possibility all you have, and this happened to us last year where we only had quadrivalent vaccine.
definitely. And I think the one thing that we find in general with patients is this, in general with humans, is that more is better, right? Quad is 4, tri is
Yeah.
3. Give me 4, it's better than 3. It's a little nursery rhyme for you. But I think what we've seen, if we follow the evidence, is we actually are finding that second B strain, so the Yamagata strain, so that's the fourth one in the quad. If we drop that, then we get a trivalent vaccine, is actually become extinct. And it was kind of decreasing over the years with some of the COVID restrictions. It's virtually disappeared. And especially for older adults, A strains are more problematic. Even from a pandemic perspective, A strains are more problematic. So actually what the WHO has recommended, and NACI has actually issued a statement to say we will be switching to a trivalent, because we have to follow the evidence. We don't want to be presenting
Yeah.
an antigen that somebody doesn't need. So I think that if someone is saying, should I get the high dose quadrivalent vaccine versus the adjuvanted trivalent vaccine? Is educating them on the fact that, hey, you know what? Currently, it's 3 strains of influenza that are problematic. So they're not missing out on anything, and in fact, we will probably see a switch to all trivalent, and that's just how we stay up to date, right? We stay up to date with our recommendations. The World Health Organization technical advisory group stays up to date on what's circulating, and patients need to stay up to date on their vaccines. So I think that's where we establish ourselves as trusted healthcare professionals, because we're up to date on the latest evidence.
Every time I talk to you, I learn something new, especially in this space. So those are all, amazing points. And I think take-home messages for pharmacists that are on the front lines. I think great approaches to kind of manage these patients if they come in with questions. And I think from my perspective, the message is clear. If you run out of high dose, feel free to give trivalent adjuvanted vaccine. There's no reason you shouldn't be doing that. Please don't send patients away. Vaccinate them when they're at your pharmacy. Let's take that opportunity and let's get as many people vaccinated this season as possible. If there's one message or anything you want to leave with here today, Ajit, the floor is yours.
Don't miss the opportunity to vaccinate. You're in the thick of it during influenza season. You have a patient in front of you. If they're your pharmacy patient, they're probably at high risk, maybe potentially due to age, medical conditions, probably both. Is offer them a vaccine that day if you have one, right? So don't let them get stuck on a particular product. Have them leave protected, right? Because as soon as we present that antigen, their immune system starts making antibodies, and it takes 2 weeks to get those up. So let's get the process going. Let's get everyone protected. And even from a public health perspective, let's keep doing our job to fire blanket our population against outbreaks and severe disease from influenza. So don't miss the opportunity to vaccinate would be my final message.
Awesome, man. Well, it was good. It was great talking to you. Hopefully next one we're in person. And as always, there's to the audience, if you've got any ideas for future podcast segments, send them our way. We'll try to tackle them. Till the next time, guys.
Till the next time, John. Always a pleasure.